Okay, hello everyone. Today is February 16th. As promised, I'm going to give you a tutorial of how my thought process works when I'm preparing a manuscript in the beginning steps. So all I'm going to do is I pick a topic. It is hot and cold weather cardiac arrest. I have not done any research prior to this besides like one Google search, and that was just a very basic search. So I'm doing this live. I did not prepare anything for this. This is not scripted. Okay, so whatever happens, happens. I'm gonna do my best, and hopefully you will see how my brain works and how my thought process works and how I can get started. All right, so again, the topic is hot and cold weather cardiac arrest. So the first thing is, what does that topic mean, right? What is that referring to? That refers to the effects the weather, to me, that refers to the effect the weather has on incidence of cardiac arrest. Okay, so in really, really hot temperatures and really, really cold temperatures, how do these temperatures affect cardiac arrest? Does it increase incidence, decrease incidence? Okay, so we need to kind of just do some research on this. So first things first, as I have suggested, I would recommend bookmarking the libraries to get the PubMed. Have this set aside here. And we log in. Perfect. Okay, so before we begin delving in, I have two documents here. The first one is the searches I do. Remember, you want to document your searches because some journals are going to ask you how you got your results, even if you're just doing like a narrative review. It's always good to document your searches and on what dates. So today is 2/16. Okay, and then we'll document our searches, even if it's only a couple of searches. The other one is our pertinent results. Okay, before we get into that, I would recommend that we kind of write down what we already know. That way we aren't just going in there, not blind, but we're kind of organized. So what we already know. Okay, so what do we know about body temperature, right? So natural body temperature is around 98.6. If you watch the movie Osmosis Jones, you would definitely appreciate this number. So around 98 degrees is our body temperature, okay? So we have regulatory mechanisms to maintain temperature, okay? We know this, okay? We know that in elevated temperature, so a fever is usually around greater than 100.4 degrees Fahrenheit, give or take. In this, you have a fever. This can be caused by like pyrogens, right? And this is a result of an inflammatory response, whether it be to an infection or, extreme stress, kidney stones, cancer, etc. So it's a stress response to some kind of traumatic event to your body as body temperature elevates. Another cause, of course, is things like seizures, serotonin syndrome, etc. So we know that fever, right? If we know the fever is implicated in stress, basically, okay, and it raises your body temperature. So what happens in high temperature? So what happens in elevated temperature, right? Well, think about it this way, right? So first of all, we see vasodilation, right? So your blood vessels contain muscles. And so when they're warmer, they're going to vasodilate, right? Kind of like think of getting a warm massage or putting heat on a muscle, it's going to turn red because there's more blood flow. So vasodilation, okay? Your body will try and cool down, so you begin sweating. As a result of this high temperature, right, you might begin having a fast heart rate because you're losing water from sweating. Okay, you are experiencing decreased blood pressure from vasodilation if it's systemic, if it's like across your body. Some of the mechanisms you have to think about. Okay, and then of course you start seeing brain effects. So the brain likes to thermoregulate, right? It's affecting metabolism, it's affecting proteins. So affect proteins. You might have heard the term denaturing before. So of course we're going to try and investigate this more in detail. I'm just kind of spilling out what I know about being at an elevated temperature, okay? And then when you're cold, what are some causes of being cold? Right? So, of course, being outside for too long in the cold, like in the winter, being cold water for a long period of time, it will decrease your core temperature. Okay, certain drug overdoses, for example, opioids, benzodiazepines, barbiturates, basically CNS depressants, will decrease blood flow. So you might pretty much see the opposite effects in being cold. You're not going to sweat because that'll cool you down even further. So you'll probably be dry. Vasoconstriction. It's the opposite effect. Everything's the opposite. It's not sweating, slow heart rate, decreased blood flow to brain and vital organs. Okay. And you'll even begin seeing like skin damage, like you might see in extreme cases, like bluing of the skin. So how does this affect cardiac arrest? Well, we're going to investigate this ourselves. But some of the theories behind this is that it puts stress on the heart, right? Especially if you have an underlying cardiac disease or heart disease, okay? So if you're someone who already has like heart failure, for example, and then you add additional stress causing fast heart rate, causing, decreased blood pressure, and the heart has to beat harder, right? And the brain is under stress from this excess heat that could contribute to it, right? Same thing in the cold temperature. Right? If you have underlying cardiac disease, or if you're just extremely cold, right, it's going to decrease blood flow to vital organs, decrease blood flow to the heart, right, and you may start seeing like lactic acid formation because you have tissues that are not being perfused, and lactic acid causes an acidosis. So there's a lot of mechanisms that are going on here. I'm kind of just going over the basics of this. So now that we kind of have laid out what we already know, we can kind of build off of this, right? So if I had to begin the introduction, right, I probably would have whole paragraphs. So introduction, we can skip over this for this video, but we can talk about a few things. We can talk about importance of thermoregulation. We could talk about, what happens in altered body temperature. So some of the things we talked about, we see here in high and low temperatures, what happens, and how it affects the heart. We can talk about that. So that could be your introduction. You could kind of do your own searching and just talk about this at a general overview. Now we're going to go ahead and do our search to start finding information. Okay, so we're going to go to PubMed. I like to go to mesh database. Okay, and again, this is live. I haven't prepared anything. So if I don't find anything, then so be it. It just kind of shows you how difficult it can be sometimes. Okay. So again, this is the review. We're going to do cardiac arrest. Okay, here we go. Arrest. And some of the things I want to look at possibly, let's see. I guess etiology could be one. Mortality, pathology, physiopathology. Okay, add a search builder. So this is going to cover heart arrest, and then it's going to put a focus on these 4 things. And it stays in the builder. Okay, now we're going to talk about maybe thermoregulation. There it is, came right up. And then let's see, physiology, add a search builder, and search PubMed. Okay, we got 26 results altogether, and there's no filters added. So let's go through these. So this is talking about this is in critical care. This is talking about like targeted temperature management after a cardiac arrest. We can skip that. If you didn't know that, you could look at the abstract, but I already know what this is from my personal experience. So if you do know that, you can skip over. If you don't, you can look into it. Go on Google. Let's say you don't know what that is. You can go on Google and type in targeted temperature management, and is protective hypothermia. So we're not looking for protective hypothermia. We're looking for harmful hypothermia and see what the effects may have or not have. Okay. But you could maybe mention in your introduction that maybe targeted temperature management is a method used, for example, to protect the body after cardiac arrest. This is for estimating brain temperature. Don't really need that for our results. Greater temperature variability. Okay, so here we go. So this is about temperature variability is not associated with a worse neurological outcome after cardiac arrest. That's after cardiac arrest, and not necessarily the effects on cardiac arrest. So we can skip over that. Okay. This is again targeted temperature management. This is again cardiac arrest, after cardiac arrest. Okay, this is about hypothermia. So let's look at this. So is it infrequent and underdiagnosed pathology? Okay, requires thermometers to measure the core temperature. Okay, initial management, yada yada. Vigorous movements can trigger arrhythmia. Right. So when you're cold and you are shivering aggressively, it can trigger an arrhythmia. There we go. So and then what I would do is I would, of course, copy this link and put it here. That's fine, as long as it's there. Okay, what else is there? Okay, and this is probably actually a review as well. That's fine. We're kind of just trying to find information. Okay, let's see. External passive warming. Okay. I'll also add here from what I read at the bottom is that cardiac arrest in hypothermia is more likely with hypokalemia, from what I read there. So hypokalemia is low potassium. Potassium is a very sensitive electrolyte that affects the heart. So if you have low potassium, it can trigger an arrhythmia. And so if you are hypothermic, which as we just said could cause an arrhythmia, then it can therefore further increase the risk. So there's two risk factors there for arrhythmia. So shivering, hypothermia, and hypokalemia. And then combining them increases it even more. Let's see if I can get the full text here. It's probably, I think I said it would do Spanish. Can we translate this? Yeah, translate. So can we get the PDF? And you can't always get the full article, unfortunately. You can't. Then you just get what you can out of the abstract. Okay. Give it a second here to load. Okay, so it's probably not available to us, unfortunately. Let's try also find full text. Okay, so it's not available. Okay, so that's all we can get. That's all that we can get out of the article. Okay, that's fine. Let's continue down. Okay. It's probably some kind of procedure here. Esophageal temperature after out of hospital. I'll look at this. Because this is kind of going back into um, therapeutic hypothermia. So we don't need that. Can ice cream headache save your life? Okay, this is kind of maybe talking about no abstract. Okay, let's go here. And again, some of these articles you wouldn't be able to get without having temple. So let's see, this is a full here, and this, okay, the education, okay, so there's nothing really here. Can ice cream, oh, it's over here, let's see. Yeah, nothing. Okay, so we'll skip this one then, go back. Hypothermia after cardiac arrest, that probably refers to, again, targeted temperature management, survival neurological outcomes. Okay. So this is again is just like about during and after the cardiac arrest. We're looking at the effects on if it causes or does not cause cardiac arrest. And I can assure you, just based on our current knowledge, that it definitely has an effect. That's why people have heat strokes, for example. It does have an effect, but we can't just say that. We have to show it in the literature. Okay, so this is again hyperthermia, fever control, and brain injury. Okay, so the brain and the heart are connected. Okay, if you have some kind of brain injury from overheating, it's going to affect the heart in some way. Let's read this here. Okay, so yeah, fever has all kinds of negative impacts. Okay, we probably know that. Okay. Okay, fever at onset in the acute setting after ischemic brain injury. Okay, and cardiac arrest. Okay. The okay. Purpose of this review is to analyze the data surrounding the impact of fever across a range of neurological and okay, so this is talking about fever control and why it's important after some major events. So this kind of goes back to the targeted temperature management again. However, it does kind of talk a little bit more about how high temperatures can worsen outcomes. So, but in previous articles, it talked about the protocol, why it's important, but this one explains why fever can be damaging. So this might be possibly worthwhile, although I don't want to cherry pick too much. So let's go through this one real quick, if we can get the full article. This one is questionable if I would even include this or not, because this kind of falls back into that same category I've been ignoring the last like 5 or 6 articles. I think because it's after the cardiac arrest, even though it is on outcomes, and it is, obviously when you die, your heart will stop. I think this is more so like a post cardiac arrest kind of protocol, which we're trying to see. I think the purpose of the topic is to see how it affects causing cardiac arrest in the first place. So I think I'm going to, and also the journal is critical care. Yeah. So this is after a cardiac arrest. So I'm gonna say no to this one as well. And again, this requires some background knowledge. It's not as clear, this article, but it's after, if you read the abstract, it was after a cardiac arrest or an ischemic brain injury. We're looking at the effects of it. Okay, so extension of time to cardiac arrest after injection of a lethal dose of pentobarbital. So that's more so how the cold affects pharmacokinetics, I think. So if you give a toxic drug that would normally kill you, like that, or a lethal overdose, that it takes longer for it to happen. I guess we could look at this and just talk about how, if you normally would have a cardiac arrest from a drug, I guess this could be a worthwhile mention. This is an animal study. Okay, I guess we can include this. Just because it emphasizes, it kind of helps talk about how it prevents cardiac arrest in a scenario where it otherwise would cause cardiac arrest. Okay, so hypothermia decreases penetration of drugs into the CNS because of decreased blood flow, which could prevent cardiac arrest in scenarios where a toxic substance or a toxic amount of substance is ingested. So it has actually like a protective effect. So in this case, hypothermia would prevent or prolong cardiac arrest. You might have heard of stories where someone, drinks an insane amount of alcohol, for example, and they actually are able to survive because they're really, really cold. So let's copy this link. Okay, there we go. I don't believe we needed to take anything else from this. Oh, well, I guess we could say it was a study in hamsters. Animal study. And then later on in the process, when we're maybe getting ready to write the manuscript, we could maybe go back and jot down study design and the number of animals that were used in the study. But initially, we're just trying to get the main points of the article from this. I guess what I'll do is I'll just read this real quick, skim this, see if anything else is pertinent. And there's once again, try this. Yeah, it's bring her download PDF. Let's try that. Okay, this is the introduction. I don't really care about that so much. Yeah, so here it's showing that. So normally the animal will die in less than an hour. And here they're surviving, looks like 1, 2, almost 4 times as long, up 4 times as long. So, if you overdose or ingest something toxic, it might prolong your survival by some amount of time. Again, we can't compare animals to humans in every scenario, but I don't think we need to include all these details because it's not necessarily about cardiac arrest. It's just something it's worth mentioning that in scenarios which would cause cardiac arrest. Okay, so we'll just leave it there. Keep going. Thermoregulatory management for mild. Okay, let's see if it mentions anything in here. It's again neuroprotection. This is the same thing. This is after a cardiac arrest or a major event. We just kind of control the temperature. Again, it's worth mentioning in your introduction, maybe, but I wouldn't include that because it's not about how it affects cardiac arrest per se. It's how it's measuring outcomes. Okay, let's take a look. Thermal care, the periop. Okay. There we go. So this is an example of not necessarily weather, but it just emphasizes that, when you're cold, things are dysfunctional. So here it's saying that if you are having surgery, temperature can drop. Okay, and when temperature drops and you're hypothermic during surgery, here are some of the events that can happen. You can have myocardial events following hypothermia. You can increase the risk of wound infections, which it can cause like sepsis sometimes. It can increase blood loss. Okay. It decreases the duration of action of drug. We already discussed that. We could say it again just to emphasize it, but okay. So what we'll do is we'll work this down. So intraoperative hypothermia increases risk for blood loss and myocardial events and decreases onset of, administered drugs. And of course, you can go back later and, hey, get more specific. So this is just the start of it. Yeah, so there's that. Anything else in the article you want to look at? Elsevier is usually pretty good at getting the whole article. So, oh no, I've been not getting lucky. Usually I'm able to at least find a couple of full articles at this point, and I've only getting abstracts. So I can assure you that when you do your search, you're going to find more full articles, and you're going to find some articles that are just abstract, like I've been seeing. Use PDF, find full article. Let's see if I can get this here. So yeah, it's not available. Okay, that's all I can get out of it. So sometimes it's all you can do. So accidental hypothermia. Okay, so here we go. Hypothermia. Thermia results in organ dysfunction. Okay, let's take a look. Paucity of, so paucity means there's not many. So paucity of randomized clinical trials. So we could just maybe highlight that. Submitted clinical trials focus on hypothermia. You can kind of maybe hint at the fact there's not much evidence out there. It likely is not. Again, it's also an old study from 2004. So take it with a grain of salt. Okay. So let's go ahead and find the full article if we can. Again, not a full article. And this is an old study too. So here we go. This is probably it, right? Yep, here it is. Okay, perfect. Okay. Okay, cold conditions. Okay, so we can mention it's mostly seen in those ages 50% of hypothermic deaths in ages greater than or equal to 65 years old. That's something that kind of makes sense from a logical standpoint. I mean, so a lot of people who are younger might be more resilient to temperature changes, whereas if you're older, maybe you're not so much. So that's something that kind of makes sense. Okay, so risk factors, chemically dependent, okay, homeless. So that makes sense. Also, risk factors for hypothermia and hypothermic death include homelessness, substance abuse, right? That makes sense because if you're using a substance, you may not know you're cold. You may stay outside longer, right? Or it might impair your body's response to say, "Hey, I'm cold. I better warm up." Right? If you're, using opioids, that also cools you down. Also, so an additive effect of the cold temperature plus the drug. And also, if you're, under the influence of the drug, it will impair your body's response to the cold. Substance abuse, and mentally ill. These are things that are worth mentioning as risk factors, right? You don't want, you can highlight this in your results. And then in the discussion, talk about how, these risk factors will increase the risk of cardiac arrest or not cardiac arrest or lack of cardiac arrest in cold temperature. Climates. Okay. Light ambient conditions. So some of this like stuff about regulation, you could possibly include in your introduction. So this is talking about how the body regulates temperature. So I'm gonna skip over this because this is more so about the body's physiology and how things work. So let's see. Endocrine disorders, hypoglycemia. Okay, I'll include them. Hypoglycemia, endocrine disorders. By the gas, probably most likely hypothyroidism. Maybe also adrenal insufficiency. I had to guess. Probably more so this than anything. And those you can look up also on Google if you don't know what they are. But if you don't know what these disorders are, you can look them. I'm kind of skimming through it and I noticed that. Malnutrition. What else? Malnutrition. Extreme ages, so really young, really old. Okay, so children, infants, the elderly, and impaired shivering. Right, and that can be a result of a couple of things. One of them being high magnesium, which is something that I don't think anybody, unless you're in like the ICU, which I'm currently working in, you probably wouldn't know that. But something that is a fact that having high magnesium will increase the shivering threshold. If you're on a drug called buspirone increases the shivering threshold. Also, if you're under the influence of any kind of drug, it can impair your shivering. So shivering is a natural mechanism to warm you up. And if you can't shiver properly, then that can make you more hypothermic. These are things that are worth mentioning because it's not just about if the cold and the hot causes cardiac arrest necessarily, but what other risk factors will increase the risk of the cold or hot causing cardiac arrest. So these risk factors can cause cardiac arrest. I can also talk about, okay, so I mentioned inappropriate peripheral vasodilation. Okay, so Peripheral vascular disease. What else? Spinal cord injuries. Let's see, cancer, it seems like. Okay, what else? Peripheral neuropathy. Okay. Skin disorders, I mean, that probably falls under vascular disease, like peripheral vascular disease, because it's a diabetes. These are risk factors for hypothermia, once again. Stroke, cancer. Pancreatitis is pretty rare. It's not rare, but I don't necessarily think that we would think about that. That's more so just like inflammatory response. Uremia, and then we'll put trauma. All right, so we'll lump things like pancreatitis in with trauma because that is a very traumatic event. And it's actually quite devastating on the body, pancreatitis. We'll call that a trauma. Okay, so manifestation. We cover all the risk factors here. So how does it present, hypothermia? Okay, so we know causes organ dysfunction. Okay. Okay. Burns, okay, psoriasis. I'll put psoriasis here. Okay, conduction. So if it's windy, is not really a risk factor for cardiac arrest. That's just something that causes you to get colder faster. Oh, dementia. How about that? Dementia too. Mentally ill is not necessarily something with dementia. Dementia is different. All right, and then what we'll do is we'll put mortality, which is 100% when temperature falls below 32 C. I'll convert that real quick. You can go to Google. I don't know off the top of my head. C to F. 32 Celsius is 89 degrees Fahrenheit. Okay, what else we got here? Okay, so I just read effects of hypothermia. We already know shivering. Tachypnea at first, initially. As you advance into hypothermia, you actually begin slowing down. So tachypnea, which is fast breathing. Effects. Okay, so initial effects. Cardia and six-fold oxygen consumption. Your body is trying to survive, basically. It's in survival mode. As you advance into more advanced hypothermia, things begin shutting down. The body is just trying to preserve the vital organs. So fast breathing has heart rate can put stress on the heart. And if you have underlying cardiac disease, this high demand can cause cardiac arrest in certain patients. Blood pressure rises, so hypertension. I'll also put elevated catecholamines, so epinephrine, norepinephrine. That kind of goes with attack cardiac hypertension because these cause it. I'll mention it because high levels of these catecholamines. And these again, epinephrine, norepinephrine, dopamine. And then what we can do is we can then branch off of this, talk about the effects of fast breathing, high blood pressure, fast heart rate, catecholamines on cardiac arrest, right? So it's kind of like a downstream effect, like a kind of a slippery slope a little bit, but not quite, right? Because everything's connected. Increased cardiac, okay, so okay. Keep going, keep going. So decreased cerebral. So in so we'll break it down by mild, moderate. So mild actually is a, I don't want to do that one. Mild, right? Okay, so it causes shivering. Yeah, we already caught. Oh, prolonged QT intervals. There we go. That can cause arrhythmias. Long PR intervals increase cardiac output. Okay, respiratory. Cold diuresis. So that can just cause you to lose more electrolytes. That causes you to lose potassium. So diuresis means you're kind of like diuresing your blood, and it's going into the urine basically, right? And you can lose potassium and sodium and other things in that. And if you lose potassium, especially potassium, it can cause arrhythmia. So that's fine. Okay. Can cause ileus. Let's see, impaired hepatic function. So in patients with underlying liver disorder, we'll put that under all because these two are under all. So that pretty much causes it. Decreased cerebral metabolism. Okay. And that means decreased brain function, which can just, again, worsen outcomes altogether. So moderate, I believe, was 32 to 28 degrees Celsius. It can cause hallucination. So not really so much with cardiac arrest. Decreased metabolic rate. Okay. Okay, risk of arrhythmias. Spelled it right, wow. Decreased breathing rate. What does that mean? It means decreased oxygen. That can increase your risk of cardiac arrest. Okay, so this is called the OHDC, I believe that's the oxyhemoglobin dissociation curve. All that pretty much means is that oxygen binds more loosely to hemoglobin. Therefore, not only decreasing oxygen levels, but it also decreases oxygen delivery to tissues, which your heart is a muscle, needs oxygen, so oxygen can cause cardiac arrest. And this is called the oxyhemoglobin dissociation curve. Is that what it was? Yes. Okay. And then changes in electrolytes. And again, hypokalemia, hyperkalemia, changes in magnesium can all cause cardiac arrest. So, okay. And then severe, it's less than 20 degrees Celsius, is decreased EKG activity. And then EKG stops altogether around 26 degrees Celsius, which if you convert to, look that up here, 26 degrees Celsius is like in the 70s. Yeah, so you'd basically be dead at 26. Decreased blood, okay, so hypotension, bradycardia, and increased stress can obviously cause cardiac arrest in patients who are at risk, but a bigger risk than increased cardiac output is decreased cardiac output. In fact, patients who present to the ICU with bradycardia and heart rate of the 30s or the 40s, heart rate is going so slow that it might just suddenly just stop beating, right? It's got to maintain some kind of drive to pump. And if it just kind of slows down, it could just eventually stop on its own. So having bradycardia is actually a much higher risk than having tachycardia by a long shot. Okay. It can cause pulmonary edema. Pulmonary edema, asystole, which basically means your heart is not beating at all. You may not have EKG activity present at around 26, but asystole is where it stops altogether. What else did I read? Apnea, where you stop breathing. Okay, pulmonary edema, ventricular arrhythmias. Oliguria basically means that you're not making urine. So that kind of hints that even if you recover someone from that cold of temperature, battle's not over, right? Because the kidneys shut down and you begin building up toxins. So even if you warm them up, they might still die afterwards anyway because they accumulated all these toxins and get like a hyperkalemia or whatever it might be. So yeah, that's a predictor of mortality, having failed kidneys. And then of course all temperatures, you see coagulopathy. I'm going to put a star here because I think you're more likely actually to clot. And is that right? You are. I know that when you get blood drawn, they put it in ice right away because they're trying to prevent it from clotting. Okay, so actually, yes, you have increased bleeding. So increased risk of bleeding. So if you begin bleeding out when you're cold, that can cause volume depletion, cause cardiac arrest from low volume. Stress ulcers. Stress ulcers can bust open and perforate, and they can begin bleeding. Stress ulcers. Ileus, pancreatitis, inflammation across the body. So I would mention pancreatitis here because it's more so an effect of hypothermia versus a risk factor of hypothermia, right? So your body's in a lot of stress and things being malfunctioning. Impaired hepatic function, so your liver can no longer metabolize toxins, kind of like your kidney. So all these can worsen outcomes and they can contribute to cardiac arrest. So these are all some of the mechanisms behind this. Okay, so let's keep going. Present with profound neurologic deficits. Okay. We'll just say increase risk for stroke, which if your brain is not functioning, your heart can't function either, depending on how big the stroke is. Okay. Okay, let's take a look. Hypotension. Fluid shifts. So it causes dehydration as a result of fluid shifts and cold diuresis. And increase ADH levels. ADH is antidiuretic hormone. That hormone makes you hold on to water. So if you lose that hormone, then you're going to lose water. So you get more dehydrated. So it further lowers your blood pressure, further lowers your water. So acid base status. So having a very acidic or a very basic blood can cause cardiac arrest as well. This is actually a very important article. This is probably going to carry a big section of our results here. So you may at some point in your search come across a big article like this, which kind of gives you like a bulk of your information, and it'll be very useful. And of course, you find other articles. You don't just stop with one article, because then you're just writing the article again for them, right? But you want to find multiple articles that kind of show a pattern, right? I might find another article that says something else. It's not this. Okay. Just spring medicine. Okay, so we have metabolic acidosis. Because of cardiopulmonary failure. Due to cardiopulmonary failure, hepatic dysfunction, right? Let's keep going. Anything else here? That's pretty much about it. Initially presents as in early. Okay, the article is done. So we got a lot out of this. We got almost a full page of information out of this, which you might get that at some point or another. So a very useful article. We're going to go ahead and save this for sure. So we've gotten 4 articles so far that say something. So far, as we have predicted, hypothermia can increase risk of cardiac arrest for a multitude of reasons. Okay, here we go. This is another article. Okay. I see. So this is more so just saying that like people can die from hypothermia, which we already did that. Okay, let's skip over that. Okay. It's more so about how you manage hypothermia, but I just might want to see if there's any kind of information listed in here that kind of emphasizes what happens. Not available. Okay. So now that we're done here, we're going to send to clipboard. Make sure you remember this. Send to clipboard all results. What that does is it 6 items added to clipboard. The clipboard. Let me copy this real quick. Copy. That's my first search. It gave 26 results and 4 articles used. Okay, there we go. And then you document this. Now the clipboard. Looks like it listed display option 100. Send to clipboard. All results. There we go, 20. So now so you want to do all results. Now all 26 results go here. Now the idea behind this is that if you do another search and then if some of the results in your next search are duplicates and you do this, it will actually filter out duplicate results. Let's say on my next search, there's 10 results, but this article reappears, which can happen. When you go to add those 10 articles to the clipboard, only 9 are going to transfer over because it's going to recognize this is a duplicate. This gives you a more accurate number of how many results you actually have. So you don't want to have duplicates. You want to be honest and truthful in your search. That's how you do it. Okay, so we're done with the search. We're going to exit out of here. I'll do one more search. I won't go through as much detail, but you can see how I do this. In a mesh database, what we'll do is we'll do hyperthermia. Hyperthermia. We'll look at etiology, mortality, pathology, physiopathology. And then what we'll do cardiac arrest. I guess we'll just do the same thing again, heart arrest. And the etiology, mortality, same things. Okay. What we'll do is with there's 31 results and to clipboard, all results, 31. Okay, so there are no duplicates here. Let's take a look here. This is more for drug induced. This is a drug reaction. Malignant hyperthermia. This is because of a drug, like an anesthetic. I guess we can look at this one just to see if hyperthermia causes death. Yes, this is okay. Yes, this is a drug induced. So the drug can cause fast heart rate because it's a stimulant. Let's take a look. Okay, again, this is malignant hyperthermia. This is a drug related event, not just high temperature. Again, malignant hyperthermia refers to a drug event from general anesthetics. Leaky feet and sudden death. I don't know what leaky feet is. Let's take a look. What is leaky feet? So leaky feet, probably something to do with fluid overload. So we can skip that. So it's unrelated. Same thing, like hypothermia. Hypothermia, succinylcholine, anesthetic induced. Okay. That you could maybe mention in introduction, possibly, the effects of like this drug adverse event and how like increased temperature and rigidity can cause cardiac arrest, just as I mentioned, but it has nothing to do with the weather. So it's just something you can mention that elevated temperature can cause cardiac death. In an example like malignant hyperthermia. So this is literally all just about the drug-induced event. So what we can do, we'll copy this. "31 results and 0 use." Okay. Now we'll go back to mesh headings. What we could do then is we could do heat stroke. Because heat stroke it usually happens in high heat. Okay, so etiology, mortality, and then we'll do the same thing in cardiac arrest. So let's just do hard rest. Etiology, mortality. Now we're seeing if there's any kind of effects between heat stroke and heart attack because they have a common denominator, right? We're trying to find a common denominator. So if heat stroke causes cardiac arrest, that means the thing that caused heat stroke can cause cardiac arrest indirectly. Okay, here we go. Exertion-related illness. So here we go. Anything here? Here we go. So what happens when you exert yourself? You increase your body temperature, right? So let's take a look. Keep looking. So we could just mention that temperature is a variable which can increase the risk for exercise-related injury. We'll call this ERI. ERI has been associated with heat stroke and cardiac arrest in some cases. Say how many. Frequency undefined. I'm going to add that in there just so I'm not like sounding like I'm like, oh, I found this article. It's like an amazing article that says it causes it. It didn't say how often. It said it's possible, right? We're not trying to overinflate our results. All right, we're done here. We already knew that going outside temperature can cause cardiac arrest, kind of, so. This has nothing to do with it, I don't think. Sudden cardiac hot yoga. That is interesting. Okay. So we're doing reviewing an article on yoga. This is okay. This is a case report. Okay, so this woman was doing yoga and she suddenly became unresponsive. Okay, we're going to convert 36.6. That's normal temperature. So creatinine kinase is super high, so there was definitely a cardiac event. Okay. Let's see what happened to this patient. Okay, so here we go. This is important for our study. So, oh, I didn't document. That's fine. I'll do it on the next. A case report of a woman performing yoga in a hot environment resulted in cardiac arrest. Patient had underlying long QT syndrome, as mentioned at the end of the case. Oh wait, negative. Never mind. Just erase that then. I didn't see. I just saw long. I just saw long QT syndrome. So always make sure you read carefully. I can, so. So high body temperatures can impair thermoregulation and result in nervous system dysfunction. What else we got here? And then temperatures above 40 degrees Celsius you know, 4 degrees Fahrenheit can result in cardiac arrest in some patients, but not always. Because patients have gone to like 106 and still been alive before. Anything else here? Yeah, that's pretty much about it. Of a postpartum woman. So 12 weeks is about 30, 60, 90 days, give or take. Approximately 90 days postpartum. So she gave birth recently. Okay. So we extracted what we needed out of this. Let me get this link here for this. What else we got? Post-mortem CT or great vessel with regard to the cause of death for investigating terminal circulatory status. I don't know anything about this, so let's see. This is kind of a hard one to understand here. The index was low. VFI, what is VFI? Okay. We'll look that up. I don't want that. I want a self-flattening index. There's really nothing on this. I was looking at the vessel flattening. Okay, so this one, flattening maps of visualization. I don't know anything about this. All right. I think this is too common. I think it's more so for MRI and CT. So I'm gonna go with this. Preventing studying death in sports. Let's see if it mentions anything about hyperthermia. Okay, so heat stroke. So risk factors. Okay, asthma is important, right? So maybe heat is not by itself, maybe not a cause of death, but if you are overheated and you begin breathing quickly and you have asthma, it can contribute to it. So risk factors for sudden death in sports include hyperthermia, well, heat stroke, really, heat stroke, which is basically hyperthermia, asthma, diabetes, and cardiac conditions. I don't think that head injuries are really relevant necessarily. I guess it could be if that's more so just death in general. So let's see if I can look at the free full text here. Hyponatremia, which I think that's interesting because usually you're hypernatremic when you're overexerted because you become dehydrated. You lose water. So your blood becomes more concentrated. So I'm pretty sure it actually should be hypernatremia, high sodium. I don't know. We'll see what it says. Here it is. So this is the caveat. See, like if you read it just without digging, you would say, "Oh yeah, having heat stroke or being overheated causes hyponatremia, like low sodium." But that's not true, right? Because I understood the physiology, I knew that usually when you're dehydrated, you have hypernatremia, high sodium, because you've lost water and your blood become concentrated. So if you read a little further, you would realize that it's what actually happens is they drink too much hypotonic fluid. Okay, so we'll actually add this in here. Consumption of too much hypotonic fluid. So let's say someone brought with them distilled water. Well, why anybody would do that, but if you did, you would actually be losing electrolytes because normal water has like sodium in it already, so you wouldn't be losing electrolytes. But if you drink hypotonic fluid, it can cause you to lose sodium. If that makes sense, because it dilutes it. um, Poor hydration. So let's see what else we got here. Long article. I'm just gonna pull the relevant things from this. Asthma makes sense because you have trouble breathing. Brain injuries, okay, we'll skip over that for now, I think. That's fine. Or recognition of dehydration slash heat exhaustion. So yeah, people who are not educated on it can increase the risk, right? So schools or organizations that are poorly educated or trained can increase the risk, right? You want to try and prevent. Okay. Okay. Asthma can cause decreased oxygen delivery. Now we're kind of diverging off on things that are not directly related, but can impact outcomes. Right? If you're overheated, you're going to start breathing fast. Right? Okay, that's just much a treatment of asthma. We're just looking at the risk factors. I'll mention not having treatment asthma is bad, which I think is a given. I'll just mention it. Yeah, so asthma can cause sweating, cause you to lose water, wheezing. I know it might seem kind of a slippery slope or like a stretch to say that, but when someone is ill, or like sometimes it's a cascade of events that causes someone to have a cardiac arrest. It's usually not just one thing. It's usually a multitude of syndromes happening at the same time that finally causes you to tip over the edge. Treatment. I guess this is treatment of asthma. We can skip over this. Um, This is more so spinal cord. I think it's more so like spinal cord injuries and hemorrhage. So that's not so much. That's more so just a sports injury. We can skip that. Same thing, cervical spine injuries, diabetes, okay. So heat exhaustion, I think it's kind of a given that when you're working out too much, it can cause like you to use a lot of energy. So in diabetes, especially type 1 diabetes, exertion can cause glucose disturbances. Okay, like hypoglycemia. Possible DKA, diabetic ketoacidosis. It can cause nausea, vomiting, which causes fluid losses. And in DKA, cause rapid breathing, cardiac stress, acidosis. Fluid loss, increased urination, is part of fluid loss. And of course, it can cause cardiac death because you need glucose for energy, which is usually severe hypoglycemia. Okay, that's fine. This is mainly in type 1 diabetes. So main thing to worry about is especially type 1 is pretty much your main risk factor. Hypoglycemia can occur because of stress. Hyperglycemia due to physical stress. Okay, let's keep going. This is management of hypoglycemia, that's fine. Heat stroke we already covered. Let's see. Stroke risk. Elevated when wearing, protective equipment because it makes you hotter. These are all things to consider. It's not just simple as you get hot and you die, right? It's a lot of factors involved with this. Oh, here we go. This is interesting. Important to acclimate to temperature over 7 to 14 days. So if one day it's 70, the next day it's 95 for some reason, that can definitely increase your risk of having heat stroke. Okay. Symptoms of heat stroke: temperature above 104 degrees Fahrenheit, via rectal thermometer. This is important because it measures your core temperature better. Above 104 degrees Fahrenheit via rectal thermometer shortly after collapse. And neurologic dysfunction, including confusion. I think it's kind of crazy with our body. If we're dehydrated, really dehydrated, our body actually you actually vomit more when you're dehydrated. So your body actually is its own worst enemy. I always was confused by that. So you actually get sicker if you're dehydrated. You think your body would try and avoid vomiting to lose water? No, your body says, I'm going to vomit more. That makes sense, right? So neurologic dysfunction, so confusion, disorientation, diarrhea, um, disorientation, nausea, vomiting, diarrhea. Okay. Loss of consciousness, delirium. Don't forget, when you're dehydrated, you also lose electrolytes. So I'll put a bracket here. So it's not in the article, but it's something that's important to remember. Okay, recognition. Cooling is important to prevent mortality. Okay. There we go. So heat stroke risk increases with increased intensity and poor physical shape. So if you're out of shape, you're going to heat up faster because your body's working harder, right? That's really important. So patients who are like overweight or out of shape and they go and let's say they go out in the summer and they run 5 miles and they never run more than a half a mile in their whole life and they just go for it. I mean, they might actually have a heat stroke. Whereas if you're used to it, you're in shape and you can handle it. Your body doesn't need to go crazy to keep up with the demand. You probably have a lower risk of that. Humidity decreases the body. I forgot about this. Decreases the body's ability to um, cool itself via sweating. Make sure I read that right. Yeah, acclimatization. We covered that already. Yeah, I think because in high humidity, your sweat evaporates faster. Okay. 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 Let's see. Lower temperature. Okay. Hyponatremia. Yeah. I'm not gonna mention that because I don't know why anybody would do that. I mean, I just say electrolyte disturbances. Okay, that's fine. Anything else here? Let's keep going. And again, hyponatremia. Nausea, vomiting, diarrhea. Yeah, it's rare. Okay, what else we got here? This is treatment. Oh, this is sickle cell. Okay. That's not really by heat, though. I don't know. That's not really by heat. Let me keep going. Um, That's more so about oxygen delivery than it's by heat. I probably can skip that. Uh, I'll mention it. Is a risk factor for emergencies. This is just more so like brain injuries. We can skip that. Lightning. Let's skip that. Sudden cardiac arrest. Let's see. Chest pain. Family history of sudden cardiac arrest. Okay. Option is family history of sudden cardiac arrest or doing sports. If you have underlying heart condition, people in your family have died suddenly from cardiac arrest, you maybe should avoid like severe exertion. Okay. The leading cause of death in young athletes. The structural cardiac abnormality. Okay. Okay. Let's take a look. This includes things like long QT syndrome, Marfan syndrome, um, cardiomyopathies, okay, and then of course watch for excessive watch excessive dyspnea, which is like abnormal breathing, or fatigue. It's subjective because if you're out of shape, you're going to be out of breath more so. But like, yeah, it's just one of those things you just have to use judgment for. Okay. Sudden cardiac arrest, hypoglycemia, hyponatremia. Seizures, that's not really, that's not so much related to heat. Cardiac arrhythmias, cardiomyopathies. Okay. Treatment, let's keep going. That's pretty much it. Okay, so let me copy this. This is a lot. Why with temperature and heat and exercise? Because exercise can cause hyperthermia and sports. Perfect. National athletes. Where was I at? Heat strokes or exercise endurance. Let's take a look. Five people died in this race. Okay. Okay, so in exertion. Okay, we're almost done here. Okay. If suspected heat stroke. Anything here I want to look at? Okay. This is pretty much just a broadening of this summary, so I probably don't want to go into this. Yeah, so heat stroke can lead to myocardial failure. I'll just mention that. Acute failure. I mean, this already said what we needed to do in the pretty much in the abstract. It's just going into more detail. But what happened was is that they were just overexerting themselves. They got too heated, heat stroke, and then they died from it, which is of course unfortunate. But it's pretty much all we need to know about hyperthermia and cardiac arrest. During a cycling. Okay, that's fine. European Resuscitation Council guidelines. Let's see, no abstract. It's from 05. I mean, this is guidelines, so probably Page is not working. Okay, can't access it. Nothing I can do about that. Hyperthermia induced cardiac arrest. Look for that. Full text. All right. So I think I'm actually going to stop here. So let me just document my last search. X out of this. Copy this. I think you get the point, hopefully, at this point. I had 10 results. I used what, 4? 3 used. I'm gonna say I used 3. I'm gonna say I used 3. 3 used. I might update that later if I do use more of it. That's basically about it. And then let me do this to the clipboard. Send to clipboard. All results. 10. So no duplicates. Okay. So look at how much we got from 3 searches. We got a total of 26, 31s. 26 is 56, 57. So 67 results. We use, looks like 7 articles, and we got almost 3 pages or so, 3.5 pages of information in like what, an hour? And this information probably will make up the bulk of my results, right? So I might do a little bit more searching, another like an hour or 2 of searching, and then boom, your search is done, just like that. So hopefully you kind of picked up on some tricks on how I extract information that's pertinent and related. Hopefully you kind of saw some methods that may help you, effectively search the literature. If you don't know, go on Google, okay, and know your topic, right? Know the background, know what happens in the body, right? And try to avoid including things that are totally irrelevant. So for example, post cardiac arrest care, sometimes we induce hypothermia after a cardiac arrest. That's not what the topic is on, right? It's on temperature, how temperature causes cardiac arrest, not what we do after cardiac arrest to improve outcomes, right? That's a totally different topic. We're looking at the effects of the weather and temperature on cardiac arrest. And we have to understand the mechanisms behind cardiac arrest. If you're not breathing right, if you have low potassium, if you have underlying cardiac disease, if you are overheated, or if you're too cold, right? These are all things that affect cardiac outcomes. So understanding the physiology is very important. If you don't know things from baseline, look them up later. You can always look them up and branch off of that. I know a lot of these things just from my experience, but if you don't know certain things, that's okay. That just comes with experience and with research. So you want to research for your research, like I kind of did with a couple of things that you saw on Google, right? So use this information and the examples, and use it as a guide to do your searches. Okay, and this information, I'm saving it, so if anybody wants to work on this topic with me, just shoot me an email and I'll be more than happy to work with you. Good luck and talk to you soon.